Hi everybody, Dr. Dan Williams, and I'd like to talk to you today about what you can do for pain. A common question I'm asked is, doctor, should I take Advil, or how effective is acupuncture in treating pain? And this is really a confusing topic, and it's very pertinent right now, because right now, as you know, in America, we don't treat pain well at all. We have an opioid crisis that's going on. We have people that are placed on opioids that just frankly shouldn't be, and it's detrimental to their health, and it's becoming a public health crisis. So the question then really becomes, what can you do for relatively minor aches and pains? So I'm guilty of taking a Tylenol or an ibuprofen every now and then. Unfortunately, it's just too convenient, and we don't like to be in pain, and I don't like to be in pain either. But let's talk about what especially ibuprofen and naproxen, what those medicines do. When they come into the body, they block inflammation, and that's how they reduce pain. The problem is that oftentimes when we injure something, let's take the example of a car accident. You're in a car accident, you get whiplash, you get a cervical pain. What happens is the strain that takes place in the tissues causes inflammation. That's how your body repairs itself. So if you think about that person that's in a car accident, they strain their neck, the body sends inflammation there, and that's your body's immune system breaking down the damaged tissue and stimulating the growth and repair of that existing tissue and helping it to grow and stabilize. So by suppressing the immune response, you're actually suppressing your body's natural ability to heal and to fix itself. So then the question is, well, what can I do then? Because I've been in a car accident and it hurts. I understand that. So that's when we can look at some other alternative forms of treatment. Acupuncture is a great one. So traditionally, the Chinese view of acupuncture is that the body's composed of these complex intermoving streams of energy. That energy should always be moving, always be transforming. When that process stops, pain and disease are the result. And so with acupuncture, the needles are placed at specific sites specific to you as an individual, and then left in place anywhere from 10 to 30 minutes. What that does is that smooths out that circulation of energy. Pain goes down. Now, modern science tells us that those acupuncture needles stimulate endorphins in your body. Those are your body's natural painkillers. But more importantly, they can also change blood flow to the area. By increasing blood flow to the damaged areas, we accelerate that healing process. But it also can go into the tight, painful muscles and eliminate the pain generators. Side effects for acupuncture tend to be very few and far between. Occasionally somebody may have some pain where a needle's placed, maybe a little bit of bruising, because it is a needle piercing the skin, and if it gets close to a vein, you'll get just a tiny amount of bruising. But again, usually that's not a concern at all. So we have minimal side effects with acupuncture. Now, when we look at anti-inflammatories, most of the time they're tolerated fairly well. But the problem is that they do take a toll on our stomach. We can develop ulcers from frequent use of anti-inflammatories. It's happened to me. We can also develop kidney problems, some significant kidney problems actually from things like Advil, naproxen. They're very hard on the kidneys, and people actually do end up with serious kidney problems from taking these anti-inflammatories. Tylenol, technically not an anti-inflammatory, but still falls into this, and it's very hard on the liver. In fact, there are many reports of liver damage from excess Tylenol consumption. So then the question becomes, what about taking these medications? And honestly, I think for occasional problems that just happen every now and then, you twist something, you go on too long of a walk on a beautiful afternoon, and your back's a little sore afterwards. Honestly, I don't see too much problem with most people taking the occasional ibuprofen or Tylenol. But certainly, if you have long-standing pain, and you're taking these on a regular basis, and by regular basis I mean more than twice a week, then that's a good sign that you need to get in and see somebody. We need to figure out what's going on and get you on the path to wellness. I hope you found this information helpful. Check out my website, www.drdanielwilliams.com.